I haven't done any of that modelling, and what I find very difficult with modelling is it can't take into account behaviour. And of course, it may not have taken into account the drop in vaccine effectiveness. And we've seen from the UK, the Public Health England report, which was quite damning of vaccine efficacy and effectiveness across the wider community, that if you've had AstraZeneca, you basically have next to no protection against Omicron. And if you've had Pfizer, you've got about 34% protection. But if you have the booster, it then turbocharges that response back to about 76%, which is great news. So one of the problems is if the Department of Health is relying on this model, why aren't they asking people to use a mask all the time? Because that is an enormous number. And we still don't know whether Omicron is increasing the likelihood of hospitalization. But just the maths alone, if you've got 25,000 cases, you will get a number of those cases in the middle-aged and elderly who may need to go to hospital. So we will run out of ICU beds and infectious diseases beds. And so really, I'm surprised that we're not being asked to do several things. First of all, test everybody coming into the country at the airport before they go into the community and potentially spread more Omicron. Secondly, give people tests to take home that are completely supplied by the government at no cost at all, so we can test ourselves regularly after socialising, and get a booster before 5 months, and wear a mask outside.
Okay, let's go to some of those things, because today the health advice in New South Wales is to wear those masks, but they're leaving it up to personal responsibility. So that's a significant shift. It's about you listening to the health advice and making a call yourself. What's wrong with that strategy?
Well, what can be wrong with that strategy is that not everybody is a virologist, and not everybody realises they have to wear their mask over their nose. So a little while ago, I was in a plane coming back from Melbourne, and people were wearing their mask under their chin because they had a drink in front of them. Now, in Hong Kong in 2003, people would put a mask on, lift it up, drink, put the mask back on. And apparently that happens in some carriers, but not in the one I was in. So people had their mask off even when they didn't have a drink, and they had it under their nose, and they were not asked to please put it over their nose because they obviously thought they'd been vaccinated and they weren't at a risk of acquiring infection, but they could be at risk of acquiring and of transmitting it. So asking people to make the decision can be difficult if they're, not highly precautious. And we need to be, given that, gosh, 25,000 cases. I expect we'll be going into a third wave anyway with Omicron, but that is horrible. It's just,
Okay.
We'll get a lot of deaths.
Well, let's interrogate those numbers, because we're also being told don't look at that headline number. It is about hospital admissions and deaths, right? And I think that's reasonable that we look at the consequences of the virus. So at 25,000 a day, if Brad Hazzard and the modelling is relying on is right, and it does escalate to that extent by the end of January, what kind of death rate are we really talking about, and hospitalisation rate? And why are you not confident that the hospital system can deal with it?
Well, at the moment, the hospital system is just dealing with it, and that's, a few hundred in hospital a day. And I'll remind you that there's usually a 2-week delay in that peak in hospitalisation when you have a peak in case numbers. Secondly, not every person is hospitalised, but it doesn't mean they're not suffering a lot. And I hear people talking about feeling as if they've been hit by a truck or a bus. So it's not easy, but the Department of Health chooses not to put you in hospital to try to keep that impact down. Now, you're then having to look after yourself. And we saw early on deaths occurring, and we had at about 13 deaths per 1,000 cases in New South Wales, where in Victoria it was about 5 deaths per 1,000, and there wasn't a delay in 2 weeks. So either Victoria's putting people in hospital fairly quickly, something was very different there. So I'm concerned that if we're just going to be told hospitalisation, we won't know where the hotspots are, and we won't know whether or not we need to start changing our behaviour. I'll just remind you, Patricia, that early on, no person in a residential aged care facility was allowed to go to hospital. So you can make the hospitalisation rates anything you want. So you might choose who's going to go to hospital and who is not. So we really do need, in the first pandemic that we've had since HIV, to know exactly how many infections there are so we can respond as a community, because it's not just the Department of Health telling us what to do and how to keep us safe. It's a relationship between the public and the Department of Health.
I just want to ask a follow-up question to something you raised on your list of things that you think should happen, and that's in relation to the booster program. It's been brought forward, as we know, to 5 months. I've had my booster. I know lots of people are lining up and trying to do it right now. When do you think we should be allowing people to get their boosters?
Well, Israel shared their data. So back in June, July, just before Delta hit them, people had been vaccinated, the older ones, for about 6 months. And that 6 months for the middle-aged and the elderly was really very high, that infection rate. But for the young adults, the infection rate really hit at about 4.5 months, 5 months. And that's because that's how long it had been since their second dose. So in other words, your immune system wanes at about 4 months, 5 months. So we need to get you before your immune system starts waning, when you have a high level of a variant, particularly variant of concern in the community, so that you supercharge your immune system before you come into contact with Omicron. So we really do need to increase the time for boosters. We need to decrease the time for boosters between dose 2 and dose 3 to about 4 months, no longer.